Hello, everyone, and welcome to the next webinar in the Institute for Health Policy Studies series on policy skills. Our topic today is health policy and Twitter, social media as a career and program development tool in health policy research. And this talk will be given by Dr. Charlie Ray. And Dr. Ray is an internist and health services researcher at the San Francisco VA Medical Center and associate professor of medicine here at UCSF. He studies virtual and digital-based care and its impact on quality and health outcomes. In addition to his work at UCSF, Dr. Ray is also deputy digital media editor for the Journal of Hospital Medicine, where he established the use of virtual abstracts and Twitter-based journal club known as JHM Chat. He's also director of the JHM Editorial and Digital Media Fellowship Program. And if that wasn't enough, you can find him tweeting at ray.charles or keeping up with his young family. So we're really delighted to have Dr. Ray with us today to share his expertise in social media. Since this is a webinar, we'll be taking questions through the Q&A forum. Dr. Ray is going to break his talk into 3 chunks. So, if you have questions as he's going along, put them in the Q&A box and we can stop and answer them as we go along or at the end. So with that, please take it away, Charlie.
Thanks, Janet. I appreciate that kind introduction. And I appreciate the opportunity to be here today to talk about something that I've enjoyed, and I think as a topic has really helped me in my career. And I'm always willing to sort of share some of the experiences and knowledge that I've gained using social media over the past several years with others. I will start with the caveat that what I'm going to say today is very much based on my experiences and sort of what I've gleaned in this space. There's no perfect way to sort of do all of the things that I'm going to talk about today. But hopefully I can give you a little bit of direction and some thoughts as well. And just as Janet sort of alluded to, I've got this discussion broken up into 3 distinct sections. Instead of making this just me talking forever, would love to sort of break it apart and have some discussion in between there. So I'm going to pause after each one of those sections. Please feel free to throw your questions into the Q&A little file there, and we can potentially discuss those as we sort of go along as well. So let's get started here. Which button is working? There we go. So again, my qualifications to give this talk. I've been active on Twitter for the past 10 years, so that's where a lot of this information really is sort of coming from. And as Janet alluded to, I've held several roles at the Journal of Hospital Medicine over the past several years, digital media editor, an associate editor there, and I've used a lot of the skills that I've sort of honed and refined at the individual level to sort of talk about things at the programmatic level as well. So like any good academic, I've got a conceptual model for what it is I'm going to try to accomplish today. Chris Carroll came up with this great sort of idea in and around sort of how you can potentially use social media to sort of engage. And you can think of it as this onion, right, that has these outer layers talking about observing, following, and engaging. And then sort of at the core is really at this idea of like, how do you sort of contribute when you're in the social media sphere? Now, research has shown that the vast majority of people who sort of use social media primarily sit on the outer portions of this diagram here. They observe, they follow, but they don't oftentimes interact. And fundamentally, I think that's fine. I think social media is a great place just to sort of pull data, pull information, and keep your finger on the pulse. That's what I use it for so much of the way in which I interact with it. But what I hope to do today is convince you with the idea that by contributing and sort of engaging a little bit more, the value proposition changes from a 1 + 1 = 2 to a 1 + 1 = 3. And what I'm trying to get folks to kind of do is evolve from just sort of sitting in the background to potentially engaging, mainly because I've taken a lot of value out of that type of engagement in my young career, and hope others can too as well. So here's my roadmap. These are sort of the three sections that I've broken out this discussion in today. First, I'm going to outline how social media can be used as a career development tool. So at that individual level, we can pause after that. And then what I'm going to do is jump into talking about social media as a program development and talk about what we've done at the Journal of Hospital Medicine over the past 7 years in leveraging social media to sort of get the work that's being published in that journal outside of our common sphere. And why do I talk about that with this group is because I know I'm sitting among very esteemed colleagues who are section leaders, division heads, who will start up institutions, who lead small groups, who are oftentimes wondering how do they get the work that they're doing out there more. And so hopefully you can sort of look at what we've done at JHM as a potential model and thinking about that as well. And then finally, I want to talk about how to be a good digital citizen. And I think as many of you all probably know, the world and the discourse in and around Twitter over the past 6 or 7 months has been rocky at best. And so that's really made me sort of become a little bit more introspective about how we should interact in these environments. And so I'm going to give what I think are some guidelines and some ideas around how to be a good digital citizen as well. So let's jump on in and let's talk about the individual level. So most of you here are academics. Most of you traipse in the world where your academic currency really is defined by writing papers and grants, right? And that's what defines my world. So several years ago, I was sitting around and I was thinking about what I call the publication life cycle, right? So how do things sort of go about in our world? And this is what I came up with, a very kind of crude construction that I suspect most of you recognize. We come up with a research idea. We discuss it with our colleagues, we find collaborators, we do the experiment, we publish the paper, and then we start all over again, right? And we just do this over and over and over. But in my young career, I kind of had this existential crisis that I suspect many of you had. If a paper is published, does anyone read it? You put years and years and hours into this work, and you publish it. And that existential question around is anybody actually engaging with my work? Does my work have impact? Starts to creep in. And I'm assuming everyone's papers in this discussion have all been read many, many times, but I can tell you I've had papers that have not been read. I know this for a fact. And there's a decent study that always floats around when we talk about this subject a little bit that sort of begs this question a little bit more. And it suggests that on average, only around 10 people will read a published article, that half of all articles are only going to be read by the authors, the peer reviewers, and the editors. I like to joke if you throw like mothers in there, that percentage goes up a little bit more. And that the vast majority of all articles are actually never cited. Now, this article is from 1990. I get it, it's a little bit dated, but I would certainly argue that with the mass proliferation of publications over the past 10 to 20 years, that these numbers feel right, and they feel like they would probably be on par. And I might make the argument that it might be worse at this point in time as well. So there's some decent quantitative data that the vast majority of research actually isn't even being engaged with. And so when you come back to this idea of what we do as academicians, and you look back at this publication life cycle, as I call it, you can sort of say, is there a way that we can sort of change this? Is there a way in which we can sort of change the paradigm a little bit and add in the ideas of dissemination engagement, right? So I'm talking about Twitter. We all know where I'm probably going with this. And so you can start to think of social media as a way to enhance your work and to push it a little bit further. We can think about dissemination engagement on an even more granular level, right? So on the left here, we see inReach and this idea of preaching to the choir. To me, this is a 19th century, 19th and 20th century modality of how science was performed, right? We do our experiments, we publish it in these, old journals that we flip paper, they're made out of paper, if you can recall that. And the only people who actually see the work are our fellow colleagues and our fellow scientists. We talk about it and not much happens. But as the world has sort of evolved, obviously we can start thinking about the idea of outreach as a different way of sort of disseminating our work. I had a very early mentor in my career who said, Charlie, if you really want to, have impact, you have to elicit change at the policy level. that's where the money is. That's where you want your work. You need policymakers, you need decision makers to know about the work you're doing. If not, most of it will fall on deaf ears. And the way in which she oftentimes told me was use social media to get your work out there so that the media picks up on it, the public is aware of it, and policymakers finally are actually seeing your work. And so when we think about social media and that use, we're not talking about in-reach, we're really talking about outreach and really putting your work out there. So how have I gone about doing this? I'm going to share a couple of examples that I thought were very helpful and sort of illustrative of this idea a little bit. So these are two tweets that I sent out a couple of years ago. The one on the left is a tweet that describes the project that I worked on during my fellowship. A 2-year project, lots of blood, sweat, and tears put into this thing. Wrote the paper, had it accepted. Sent it out, and obviously, the days after, weeks after, nothing, crickets. Didn't hear from anyone. Spent all that time and energy, and didn't get any sort of feedback. Didn't engage with anybody on it in any level. So my mentor said, "Charlie, tweet out your article. Like, see what happens when you do that." So this was the article. I tweeted this out, and all of a sudden, 40,000 people, 40,000 impressions. Is sort of what this elicited here, and 205 individuals clicked on the link to my article. Now, it took me 2 years to do that work, but it took me 5 minutes to put together that tweet. And all of a sudden, 40,000 people now had 40,000 potential people had the possibility of engaging with my work at that point in time. And 205 people who never would have known about it before ended up engaging with that work at that point. 5 minutes of work, and that's what I got out of it. The second article was a labor of love. I really enjoyed writing this article with my co-author. He and I published it in a well-known journal, Annals of Internal Medicine. Of course, didn't get a whole lot of feedback on it initially, but tweeted that out. 31,000 impressions and 163 people ended up clicking on that link. I ended up giving 3 or 4 talks based on this paper just because of people sort of finding me on Twitter and saying, "Great paper, we'd love to have you come talk about it." Again, this idea that we spend years working on our work, but we've got to spend about 5 minutes just to put it out there. I'm not the only one who believes in this idea. This is a paper that was published in Academic Medicine a couple of years ago. Tony Gallo, the managing editor, put this together. And I just love the title of this paper. "Congratulations, your article has been accepted. Now what?" And you can see where he's leading with this idea as well, which is the use of social media outlets, things like Twitter, Facebook, and LinkedIn, to really engage and push your work out there. Now, I think he kind of buries the lead a little bit here, but in the bottom, as I've highlighted, you can see he says here, "Remember that publishing your article is not the end. Getting the word out can help ensure that your work has an impact." And that's what we're talking about here. Coming back to that in-reach, outreach paradigm, we really want outreach. And in-reach is something that we did for decades. But if you want your work to have impact, think about outreach in that perspective. So that's the end of the first section. I hope I've convinced you in some capacity that you put so much work into your research and to what you're doing. Take the extra time to put your work out there so that people know what it is you're doing, what it is you're working on, and your expertise as well. So I'm going to pause right there. Janet, are there questions or anything that I can address?
No questions in the Q&A forum right now. I will just reiterate my answer to the one question we had, which is yes, this session is being recorded and it will be available later. So we'll give it maybe a few seconds or so here. Let me see. No, nobody's typing. So I would say, Charlie, when you're ready, you can move on to the next segment. Oh, whoops, there we go. All right, here we go. Let's see. First one on slide 12, surprised to see that government policy is a layer outside of the public. Could you speak to that?
Surprised that they're probably one and the same. Largely in that larger sense. I think, public policy is oftentimes reactive to what the general public is talking about in some capacity as well. So, I wouldn't get too caught up on the details on which one of those layers should be on top of one of the other. I think the central premise is the idea that you want your work to hit lots of those layers, and that we're trying to just expand beyond the ivory towers that we currently sort of exist in.
Right. Okay. Next question. How about following journalists on Twitter?
I think it's fine to follow journalists. I find it's oftentimes the opposite. If you know journalists are always looking for stories, right? And in the past decade or so, journalists really have turned to Twitter to find folks that they can interview for their stories. That happened to me a lot. That has happened to me a lot, actually, over the past probably 4 or 5 years. And journalists have reached out to me for comments on their stories. And so if you are someone who is looking for that type of engagement, they will oftentimes find you, but you can also follow the Twitter. You can also follow journalists as well. So I think that's fine. I don't see anything wrong with that per se. Yeah.
Okay. And then I think last question in this set, how do you ensure that your tweets get a lot of hits? That you get to that 40,000 or what?
Yeah. So you're asking what's in the special sauce there. It's hard to say. If I could predict what tweet was going to get 40,000 impressions versus 200, I'd be a millionaire. I can't figure that out. There are things when I will tweet out and be like, this is really great. I think this is really impactful. This is an important idea, and people will like this. This idea or this paper or whatever it is I'm sort of trying to put out there, and it'll be crickets. And then the most benign thing I put in the world when I'm trying to wrestle my kids to the ground and I'm tweeting in the other hand, and that gets 20,000 hits or whatever the heck it is. So it's a fantastic question that I have not solved the mystery to. I think one of the central things is, and I'm going to talk about this more, is if you create your community, find your community and build that community up, you're much more likely to have support. You're much more likely to people sort of look at your ideas and like your ideas and retweet your ideas and put it out there. I'm going to talk about other ways in which you can potentially increase the engagement of your tweets as well. And I'm going to talk about that in this next section. But to answer that question, the essential way is I don't know quite yet. There are some tips and tricks, and I'm going to talk a little bit about some of those going forward.
Okay, last question in this set, and then I think we need to move on.
Sure.
Is the number of impressions linked to the number of followers you have?
Yeah, I mean, it's probably a direct correlation. If you have 100,000 followers, right, and you tweet something, the number of impressions are certainly going to be higher than if you had 10,000 followers per se. But what you can do is you can amplify that. So you tag people in your tweets, right? You tag that community. You can do what are called subtweets. So you can tweet underneath it and tag other people as well, so that they help amplify your message. So there are some tools and tricks of the trade that you can sort of learn along the way so that you can increase the number of impressions. But to answer the central question there is, yeah, I mean, famous people's tweets get seen more so than non-famous people's, just because there's that correlation with their following.
Okay, great. So I think, Charlie, let's get back to
Sure.
the segment.
Wonderful. Great questions. And hopefully I can build on some of that with these next few sections here. So social media in program development. And as I mentioned at the top, these are some tools that you can use both as from a programmatic standpoint and from an individual standpoint as well. I think there's a lot of overlap here moving forward. Okay, so as I mentioned, I've done a lot of work with the Journal of Hospital Medicine. I'm very proud of this work because we were one of the first journals to really embrace the use of social media, primarily back in around 2015. And so we were sort of at the vanguard of a lot of these ideas and helped develop a lot of these things and continue to as well. And so the two things I'm really going to talk about is the first are the idea of what are called visual abstracts. And then the second thing is the idea of our JHN chats, or our monthly online journal clubs as well. So first I'm going to talk about visual abstracts. Now, many of you here may look at this and say, this may look really familiar to you. You're starting to say, Charlie, this looks a lot like the posters that we present at our national conferences. And I would say you're exactly right. The visual abstract is easily put here as a visual summary of the information contained in an abstract, right? There's a fun story behind how these were created. This gentleman in the top right-hand corner, this is Andrew Ibrahim. Andrew was an architect who got tired of being an architect and went to medical school and is now a surgeon and a health services researcher at the University of Michigan. In 2015, the Annals of Surgery said to Andrew, we have no idea how to run a Twitter handle. Can you please take over this at this point in time? And Andrew, with his with his background in architecture, said, I think people engage with visuals so much more than they do with sort of the written word. There's good data to suggest that. So why don't I come up with a really quick and easy way to help the journal engage its Twitter followership? And so we created the VisualAbstract. It's just a very simple tool that is embedded in every single tweet. Again, as I sort of alluded to, it's this idea of that really sort of harkens from the posters that we present in our national conferences. There's some driving forces here where the idea of like less is more is a little bit. The idea isn't to convey the whole, the entire manuscript, but rather, as Andrew likes to put it, it's the movie trailer to the manuscript. So you're trying to entice people in and around what was published to click on the link, to download the paper, to think about it, to reference it, and that sort of thing. And so it's a little nugget of enticement in social media. When everyone's scrolling by quickly, you've got to capture their attention, and that's what Andrew recognized. You can see that lots of journals have picked up VisualAbstracts over the years. New England Journal, BMJ, JAMA has been doing them for years. Academic Medicine, Cochrane. And so these are quite ubiquitous now in and around social media. And as I like to say, when Atul Gawande says something's cool, everybody jumps on board, and that's kind of what happened in some larger sense as well. These are a few examples of what we've done at the Journal of Hospital Medicine over the years. These are some of our early abstracts or VisualAbstracts that we posted. Again, these were just posted in our Twitter feed. So as people are sort of scrolling through, the idea and the hope is that the visual captures their attention. All of a sudden, they're sort of pulled in. Oh, that's a really interesting article. I'm going to go ahead and download that article as well. We actually put these VisualAbstracts up on the JHM website so people can download them and use them for teaching aids as well. And so we've actually, evolved in these at this point in time. They've become much easier to make in recent years with sites such as Canva, and there are several others, these sort of creative arts and designing websites. You can create really good looking abstracts, and that's where we have evolved at JHM as well. But as many of you here are probably thinking, well, Charlie, this is all very nice and good, but you spend all this time making VisualAbstracts. Are they actually accomplishing the task that you're setting out to accomplish? And Andrew and his mentor, Justin Dimick at Michigan, they're both HSR folks. They said, we should probably study this. And so here's their study here, published in the Annals of Surgery. They did a really nice case control crossover study, very simple. They took 44 articles. They tweeted 22 of them with the title alone, and the other 22 they tweeted with the title and a VisualAbstract. Nice washout period, and then redid their experiment. And then they looked at Twitter-based outcomes. They looked at impressions, retweets, and article visits. What did they find? Impressions, if you included a VisualAbstract, increased almost 8-fold. Retweets, more than 8-fold, and article visits increased 3-fold. So I come back to what I was talking about in the very beginning. If your idea is to have impact, disseminate, engage around your work, this is a great tool to think about doing that as well. The other thing I say is what makes these findings so important to me is that at the time, Annals of Surgery had 1,300 print subscribers, but they had over 31,000 Twitter followers. And so it goes back to that old saying of, why do we rob banks? Because that's where the money is. Why are we putting our work in social media and Twitter? Because that's where people are at this point in time. I'm going to switch gears a little bit, and I'm going to talk about Twitter chats. And if you walk away with anything here, this is the idea about finding your community, finding and building that community, and what it can do for you as well. So in 2015, My mentor and I started up JHM Chats. And what these are monthly discussions. We would take an article that was published in the Journal of Hospital Medicine that we thought was interesting, and we would do a talk. We still do them on Monday nights at 6 p.m. And we bring hospitals together in and around a very specific article, and we discuss that article in multiple ways. And what that's done is really created this community in hospital medicine that extends even beyond social media, so that now when I go to conferences now, my network is massive because of this type of engagement. And I've certainly was one of the founders of this, and that's been great. But I've had people tell me who have engaged with us that indeed it has expanded their networks on multiple levels as well. So like any good researchers, what did we do? We wrote about it. We published this article several years ago describing the implementation and sort of assessing its impact on certain metrics. And so we looked at Twitter-based metrics, such as the number of participants, number of tweets, impressions, that sort of thing. But we also wanted to see from the journal side, the bibliometric aspects. So how many people are looking at the articles we're discussing? Are there changes in the altmetric score because of these discussions as well? So busy slide, but I'm going to walk you through it real quickly. We were hospitalists, and so we talked about three types of articles during these discussions. Things that usually went around value-based care, quality patient safety, and medical education. We averaged at that time around 2.1 million impressions per discussion. And more recent data, we're actually closer to 3 million at this point in time. We averaged 76 participants. So once a month, we got around 76 different people together to have these discussions. And granted, we oftentimes had the same group kind of come in. We had a core group, but we'd also have people sort of come and go based on the topic that we were talking about as well. And finally, altmetrics increased around on an average of 8 points 2 weeks after having that discussion. So bibliometrics improved as well. And from a journal standpoint, again, disseminating, getting the journal's name out there was something that was really important to us. And we think that using JHM Chat as that community builder worked quite well. So that's the end of that second portion. I'm going to pause here. And Janet, any questions? We'll give folks a few minutes here.
Sure. Let's see. Okay. So this is a question that's really more about websites.
Okay.
If you recommend that researchers have personal websites or lab websites, how important is this?
Yeah, some people have done that very well. The first person who comes to mind, Irma Malasarkar, has a lab website, and she blogs there as well, and she's very active on that. And then what she often will do is tweet, what she just blogged, and so those things are oftentimes talking to one another. I would argue that if you're going to have a website, you should keep it up. Nothing looks worse than a stale website when you go on to someone and the last posting was from 2014 or something. I think if you do have one, you can certainly connect it with your social media feeds, and I think that's a great way to connect all those things and meld them together. But if you're not actively going to sustain it, it could potentially hurt just from an external standpoint. But that's my opinion. I'm sure others may have other thoughts in and around that as well.
Okay, thanks. Let's see. I don't have any other questions right now. We'll give folks a minute.
Sure.
Anybody else would like to ask a question, please put it in the Q&A box. Let's see. Well, thank you, Charlie. And then now, so that's great comment. Next question. Noting that a lot of your discussion is about Twitter. And so the question is, what is the future of Twitter as a platform, and what are best alternatives?
Yeah, I do. I get asked this question all the time. And again, I come back to if I knew the answer, I'd be making a lot more money than I currently do. Obviously, as most people probably know, Twitter is probably still going through a rocky period at this point in time. I don't know where it's heading. What I can tell is share with you all our thoughts on the journal side, because the Journal of Hospital Medicine has utilized Twitter to such a great extent. We've talked extensively about, do we need to stay here? Do we need to go someplace else? And if we gave up Twitter, we would be giving up, the 16, 17,000 followers that we currently have and starting all over again. And so there have been lots of discussions around on how to best navigate that at this point in time. We've made the decision to stay. I feel like a lot of the discourse that has sort of occurred in this platform has quieted down a little bit, and I hope we're heading back to some normalcy. And I've stayed personally as well. I've been much more quiet in the past several months as well. So that's the way I kind of navigated, I think, some of those ups and downs. The other places that people have been talking about, obviously, Mastodon was the big one that was quite popular for a while, but I feel like that's peaked, and not many folks are over there at this point in time. People talk about already established places, LinkedIn as being another good alternative. I have another colleague who's in social media, and she very much believes TikTok is the next place that everyone's going. But given all of the legal aspects that are potentially occurring around TikTok, I'm not quite sure I'd step over there quite yet as well. So I don't have the answer, and I really wish I did. My hope is that Twitter kind of falls back into where it was, a year, 2, 3 years ago, when there was a little bit kinder discourse between everybody at that point.
Okay, we do not have any other questions in the Q&A box right now. So Charlie, I think let's move on to segment 3.
Yeah. All right. So this last portion is how to be a good digital citizen. And this really is sort of a reflection of, starting in October of 2022, when the world kind of got turned upside down inside Twitter. And I saw a lot of people who I admired in a lot of capacities, who oftentimes I didn't feel like were acting as good digital citizens. And I'm going to kind of define what I hope that means to a lot of folks here. And again, I will say that this is how I sort of operate. It's not the end all be all. And I would love to hear how others sort of think about this when we finish off with this section as well. So how to be a good digital citizen. We're going to do this in 3 parts: teaching and education, advocacy and networking. And why did I choose these 3 parts? Because I think this is the main reason why people enter into social media. People are there to learn and or share, and that's sort of that teaching aspect. People are there to advocate and stand up for things that are important for them. And then finally, in our world in academia, networking is so incredibly important, and is something that I think a lot of people step into because of those reasons, and then stick around for those reasons as well. So let's jump in. Citizenship when you're being an educator. So the model that I've used that I've come up with a lot of these rules is really based on how I comport myself when I am teaching and interacting with learners on the wards. I'm a hospitalist, so I interact with medical students and residents in the hospital and in that environment. And on any given day, I usually have 4, 5, 6, 7 eyes on me at any given time. As many of you all can probably relate, you're on your best at that point, right? You're always on your best behavior. Your shirt's tucked in, you're looking a little bit better, you're acting a little bit better, and that sort of thing. And I think we'd all sort of admit that. But I would argue that we need to be operating in the same capacity when we're operating on social media, because it's not 4, 5, or 6 eyes on you. It's thousands of eyes on you at that point in time. So I think the stakes are a lot higher at that point. And so it's that idea that's driven me for a lot of these ideas and around how to sort of educate. So one of the first things I always tell people is give proper attributions to the authors of a study. And just as we would on the wards, when somebody does a good job, we say, "Great job, Susan, for doing all that great work today." I didn't do the work. Susan did all the work. And so let's make sure that she gets the proper accolades. I put a little example here on the right. This is Guy Toledans is one of our digital media fellows, and he does this great job of putting together these visual abstracts on levels that I can't. Like he's so much more creative than I am. And so my tweet here was just basically saying, look at all this great work that Guy is doing over here. And so I wanted to give him that attribution. And what this ends up accomplishing is the triple win. And many of you have probably heard of this before. So the triple win is Gian wins because he put hours into this work and someone recognized it and sort of elevates his work. So he wins. I win because now I'm an upstander and I'm helping him out. People start to view me as someone who can support them, which is what I'm trying to accomplish as well. And then everybody else wins because they get to see all the great work that Gian's sort of putting together. So just as we give attribution on the wards and in our in-person environments, make sure that we're giving attribution to people's work and the social media sphere as well. The second thing I say is provide sources for your statements. Misinformation has been a really big issue over the past several years, in and around the pandemic. And so one of the things that I've come to respect are individuals who say, here are my thoughts and opinions, and they're based on, this idea here. And they'll post their link to that source and that sort of thing. And pivotal to that is that you read and understand what it is you're posting and retweeting. I've fallen victim to this. I've retweeted something before and then gone back and reread it and gone, oh gosh, like that wasn't great. I probably shouldn't have done that in some sense. And so learn from my mistake. And if you're going to retweet something, if you're going to put something out there, make sure you're understanding what it is you're putting out there. The third thing is don't delete, discuss. So again, I've made mistakes on social media. I put things out there where I was wrong. I was just flat out wrong. And someone called me out on it. And, obviously my first instinct was delete, get that thing off of there. I don't want to look like an idiot. But I sat back and I said, no, this is a great opportunity to model for myself and for those who follow me on social media of it's okay to make mistakes and it's okay. You have to own those mistakes. And so I went back and said, you're right. I apologize. I got that one wrong. My fault. And I think that that's part of that global idea of citizenship, of someone who's contributing in constructive ways, recognizes when they get things wrong, and then tries to do good for that as well. So view your tweets from all angles. Recognize that when you are sending information out there, that oftentimes that information isn't just yours. I'm a clinician, so I see patients, I interact with learners and that sort of thing. And so I have to be very careful that what I'm saying and what I'm tweeting doesn't actually, someone's not going to misconstrue or it's not going to be about them in some capacity. And so what I oftentimes do is I say no same day tweets. So if I have an interesting interaction on the wards, if I have an interesting interaction with a colleague and or a learner, I'm not going to tweet that on that day. I'm going to give that some time so there's greater dissociation between what I'm putting out there and that individual. And of course, stripping it of names and PHI and that sort of thing, if it's sort of involved. So these are a few things that have sort of guided me in trying to be an educator and teaching on social media. Let's switch gears a little bit. Let's talk a little bit about citizenship when advocating. And I'll be honest, when I first got into social media, it was not to be an advocate. I started social media when I was a second or third year resident. I felt like a learner. I didn't feel like I had a voice. I didn't feel like I had much of a stand or rather a soapbox to stand on. But over the years, I developed a voice. I developed the things that I'm passionate about in some capacity, and have become, I think, more confident in the way in what it is I want to say and when I'm advocating for social justice issues per se. And a lot of this was actually changed by an article I read a couple of years ago. I'm going to do the classic faux pas here. I'm going to read from my slides, but I think this is such an important statement here. The current generation of physicians is the most challenged by moral choices in perhaps a century. Those choices come in three tiers: personal, organizational, and societal. The work of a physician as a healer cannot stop at the door of an office, the threshold of an operating room, or the front gate of a hospital. The rescue of a society and the restoration of a political ethos that remembers to heal have become the physician's job too. Professional silence in the face of social injustice is wrong. And this was written by the great Don Berwick in an article, Moral Choices of Today's Physicians. And this article hit me hard. It was the idea that, I can certainly take care of my patients, in the hospital room and within the hospital confines. But I have a voice and experiences that I think translate beyond those walls and are things that I should be talking about and I should be sharing. We as physicians and as health policy and researchers out there, we have a lot of social capital, or at least we used to have a lot of social capital. And I think we should leverage that, and I think we can. And so here are three rules that I think about whenever I'm thinking about advocating on social media. The first is tweet from where you stand. And what does this mean? I talk a lot about this idea, especially with young learners who often say, Charlie, I don't know if I have enough expertise to be tweeting about some of these social justice issues or some of the societal ills that we're talking about. And oftentimes I will say, you absolutely do. As a medical student or as a resident, you see the ills of gun law, of lax gun laws, of the opioid and epidemics, of misinformation, in and around COVID. And you experience it on a daily basis. So leverage those experiences, leverage that knowledge, even as a medical student, even as a resident or a junior faculty. You know more than the vast majority of the people out there. And so I think you do have a bigger soapbox than what you think, and don't be afraid to stand on it. And so I'm always encouraging whenever I'm having this conversation, again, with junior faculty or young learners as well. The other thing that was often taught to me many years ago in a different context, but I think translate really well into social media, is if you want your data, if you want your research to connect, find a way to tell it in a story. We as academicians, we traipse in odds ratios and models and p-values left and right, but those fly over the heads of even the smartest people out there. The thing that lands are stories, right? And so if you can find a way to tell your, give your data a storyline, people will be much more likely to sort of buy into that and to hear you out in some sense. If you think about COVID, and everything we've gone through over the past several years, people held on to the stories of their families. They didn't hold on to the numbers. And so when you're advocating and when you're pushing for those issues, think about stories as a central crux as well. And the third thing is make space for others when you're being an advocate. I have been blessed for some reason or another to have a megaphone. That's what Twitter is for me. But I've recognized that it's not always up to me to hold that megaphone and to say put my words out there, but it's to give that megaphone to other people so that they can spread their message as well. And so I feel like it's part of my responsibility is when I find someone who is doing what I think is good work and saying smart things and is trying to change the world for good, is to amplify their voices. It's not to say something on top of them. It's not it's not for me to say anything, but rather just to amplify their voices as well. Finally, citizenship when networking. This is a very common reason why people are on social media at this point in time, is to make those connections. Academia is a small world, but nonetheless, social media makes it even smaller. And one of the things I've loved about my experiences in this world and social media has been making connections to people I never would have met had I not been on social media in some capacity. And here are a few things that I learned over the years that are guiding principles for me in ways to sort of connect. So first is know your voice and what it is you're trying to convey. Oftentimes we are known as these entities in social media. People sort of they put their labels on you, and you can control what that label is. And the way I think about that is how you can sort of functionalize that is by using a voice document. One of my colleagues, Gopi Astic, she's a hospitalist at Northwestern, uses what's called a voice document. And what it is about once a quarter, she revisits this voice document. So she types out here, like, what's her elevator pitch? Describe the voice as if she were a person. Describe the tone of that voice. What is she talking about? And then she importantly says, what is she not going to talk about as well? And that gives her those boundaries, those lanes to operate in, so that if she's thinking about engaging on some topic, she has to sort of think back to her voice document and say, is this something that matches what I'm trying to put out there? If it is, great, engage. But if it's not, probably don't engage in some sense. And so think about that tool as you're potentially stepping into this sphere. The second thing, and I will say this is something that has morphed and changed for me and is very personal, and not everybody will agree with this, but I'll put it out there because it's worked for me. I think it's okay to be human on social media. And what do I mean by that? When I was first on social media, I never said anything about my life outside of work. I only tweeted about the articles I was reading, the cool things that I saw, work in general. And that sufficed and worked really well for me earlier on. But what I found is that as I've talked about myself beyond work, talking about being a husband and a father, my failures, the things that have gone well and the things that have not gone well for me, it humanizes me in some capacity. And more people have sort of come to me and said, Charlie, like, thank you for saying that. I was feeling the exact same thing. And so I found that to be a great way to connect with people. And I've noticed when other people do it too, I kind of flock to those tweets and those individuals because yes, we can get to know people on one level on social media, but that deeper level, I think, really helps as well. I think it's also good modeling to be vulnerable a little bit, especially for some of our learners. I know I remember thinking that when I was going through training that, my attendings and the upper level physicians out there, they were invincible. They never failed. Every grant was funded. Every paper was accepted. But if I can show folks that, no, that's not the way the world is, again, I think that's helpful for people who are sort of looking at us as role models in some sense. And then finally, find that community, find or create that community. That's what we did in 2015. We created this community for hospitalists because we recognized that people wanted that type of interaction. It was incredibly helpful during COVID as well. We had some of our highest engagement during the heights of the pandemic. And it's been an incredible way because I know that whenever I tweet something out there, I've got a dozen or more people who are going to like it and push my message and push that thing out there. And that's been very supportive for me, and I've really engaged and I've really enjoyed that as well. So central is find and build that community. Now, as I sort of wrap up here, I've got, I think, 2 more slides left. I oftentimes, why is digital citizenship so important? And I'm sure many of you have heard this idea before. So you're the average of the 5 people you spend the most time with. People spend on average 147 minutes a day on social media platforms. Thus, you are likely defined by who you follow and interact with on social media. So my central idea, the central premise is that if you're a good citizen, then I think others will be too. So I'm always trying to model that in some capacity. I'm not perfect in every single way, and I've made mistakes. But I think if we all try to achieve a little bit higher standard, then I think the conversations on these platforms can improve as well. And I love this quote, Edward R. Murrow, just because your voice reaches halfway around the world doesn't mean you're any wiser than when it reached only to the end of the bar. So remain humble in there. These are my 2 boys. I put them on every single talk, but they also inspire me to be a good digital citizen as well. So that's it. That's all I've got for the group. I have some questions here on how do you think about digital citizenship? What are qualities of a good digital citizen that I potentially missed as well? So happy to finish off and take some questions. And you can reach me obviously through my email address, or you can find me on Twitter.
Oh, thank you very much, Charlie. Great talk. Our next question is about a difficult topic, which is how do you handle Twitter trolls, negative comments, or comments you don't agree with?
Everybody has a different way of going about this. I personally, I don't engage. If it's a troll, if it's someone who I just know is just trying to get underneath my skin, and I know there are sort of just nefarious reasons for them engaging with me, I don't engage. And that's hard. Like, that's hard to do at times, right? When all you want to do is argue your point and come back, but it's not productive. It's not productive. It's not going to change anyone's mind. It's not going to change the world by any regards. And I think stepping back and trying to take the larger view of, like, is my tweet going to change this guy's idea or 2 or 3 other ideas? Obviously not, or probably not, rather. And my goal is to not be the guy who's arguing with everybody, but is rather, again, trying to be constructive and be a good digital citizen. And if in an in-person interaction, someone came up and started poking me and trying to get me an argument, I would walk away then. So I would walk away. So I do the same in social media spheres as well.
Right. And I got a comment. Great talk. Thank you. I really resonate with being selective about which threads my brand engages with and promotes. It can be subtle, but it's good to be judicious.
Yeah, I love Gopi's voice document, and the things she tells me what she does. She kind of takes a look at it about every quarter, and sort of re-engages with it to make sure that it's up to speed with what she's trying to sort of put out there, and whatnot. So I think that's a nice functional way of going about that as well. And there have been times when I've engaged in tweets before, I'm like, yeah, that's kind of off brand for me, in some sense. And I probably shouldn't have engaged in that mechanism, because as most people recognize who have been in this space, we have our brands. Branding is the simple way in which people sort of view us, and you have to maintain that in some capacity. And so I think being thoughtful about that is important. So I'm glad that resonated with some folks.
Mhm. Charlie, I wonder, since we don't have any other questions at this point, if you could talk maybe how, to what extent, if any, is your department working with you and your colleagues on social media as opposed to a kind of every person for themselves model?
Yeah, that's a great. I've had over the years, multiple departments and divisions sort of reach out to me to think about strategies in and around the use of social media. This was all kind of pre-pandemic. I was really lucky. Joanne reached out to me from IHPS a couple of years ago, and I helped with the social media outreach for the annual HSR research meeting that was done online. I guess that was 2 years ago. I might be getting my dates wrong now. And so, yes, people have reached out to me in that capacity, and we've certainly talked about it. I wish departments and divisions would put a little bit more emphasis on this as a whole, and sort of, UCSF holds everywhere, like making sure your profiles page is up to date. They can't force people on to social media by any regards. But I do think it would be helpful if there was a few more nudges from the institution to get people out there. For the large part, I think we have good representation from UCSF as well. Department chair, obviously, Bob Wachter has been on Twitter now for, probably 15 years or something, and has a very well-known following. And the department is just full of folks who are out there. So, I don't know if there are a lot of nudges needed, but I'm oftentimes encouraging of folks if they're thinking about stepping into the water.
Well, let's see, folks. If people have more questions, please put them in the question and answer forum. And maybe while we're waiting, I'll ask one more. And so Charlie, you talk about sharing your family, sharing your your life outside of work. And maybe this is just well, I'll ask it this way: is how do you then balance that, which clearly can be a way to humanize yourself, with like protecting the privacy of your family?
Yeah. I think that idea exists on a spectrum. Like, I know some people who will just straight up tweet what their kids' names are, their address, and that sort of thing, right? So that's one end of the spectrum where there's just full transparency, and then there's other end where people won't talk about it at all. And for me, and I had to have this discussion with my wife. I was like, how comfortable are you, with me posting stuff? And if you follow me, you'll see that, I'll post pictures of my kids. I don't put their names out there or anything like that, but they see their faces and whatnot. And that was a discussion that my wife and I had, and that's where she was comfortable and I was comfortable as well. And I don't give much more than that as well. So we found our limits, and that's where we're at. Again, I know people who are much more willing to go further than that. And that's okay. And I think, again, that there's just some personal decisions that have to be made there.
Okay. Let's see. Last call for questions. If not, I think we'll end a little early. I want to thank you not only for the discussion of the mechanics of using Twitter and social media, but I think you've given us a lot to think about in terms of how to be good digital citizens. And I especially appreciate the effort you make to amplify the voices of others. We have another thank you. Yeah, I think that's so important. And it really always, I think sometimes in academia, we have this tendency, it's all about us.
Yeah. Yeah.
And I think if we can remember in our actions that, yeah, we should be proud of our work, but also amplify the voices of others, particularly I think the junior researcher scholars, folks in our community, to help their work be noticed.
Couldn't agree more.
Mhm. All right. Well, with that, I think we will end a little early, and the webinar will be recorded if you want to watch it again, or if there's folks in your department, your ORU that you think would be interested, and we'll make sure that we get that information out to you through IHPS. Thank you very much, Charlie. This was wonderful.
Wonderful. Thanks, Janet.
Okay, bye, everybody.